I was thinking actually to start, it'd be great if you could give us like a general definition of some sort so that we can understand how prevalent it is and have a basis or a foundation to begin the conversation.
Violence against women has many names: intimate partner violence, domestic abuse, other topics. But basically what it means is the violence that women suffer within their own homes. I thought it would be useful to start out with the definition that WHO and the United Nations offers, because that entity is very concerned about violence against women and concerned right now about what we're going to talk about today, which is that it's increased greatly with COVID. So the definition from WHO, the World Health Organization, is the following. The United Nations defines violence against women as any act of gender-based violence that results in, or is likely to result in, physical, sexual, or mental harm or suffering to women, including threats of such acts, coercion or arbitrary deprivation of liberty, whether occurring in public or in private life. So that answers a question that many people have, is whether or not this has to be a physical act or a physical injury against a woman. No, it includes physical, mental, and sexual abuse or violence. It is quite common, never mind whether we're in the middle of a pandemic. This violence against women is itself a pandemic. 1 out of 3 women worldwide, it's estimated and it's been studied, will suffer violence against women in their lifetime. Some countries are much more violent than others, but that 1/3, 1 out of 3 women, applies pretty generally to most countries, and certainly it applies to the United States, Mexico, South Africa, and a good number of others. The prevalence under COVID or in COVID has risen hugely, and it hasn't been studied that much yet. What we know so far is that it's rising in essentially every country that is reporting at all. Rising to a point where in the UK, for example, the United Kingdom, they estimate that violence against women is about 9 times more prevalent now than it is in usual times. That is 1 out of 3 women experiencing this. In many other countries throughout Europe, France and Spain, the percentages are about 20 or 30% increase under COVID. And we can talk a little bit, maybe you have your ideas about why this might be the case. But violence against women is essentially a pandemic that already exists. And COVID is another pandemic that's on top of violence against women, and in fact exacerbating it. We're trying to beat it, people staying in place in their homes. When in fact, if we're concerned about the pandemic of violence against women, we're asking women to come out, to tell their friends to seek help, and to let us know what's happening with them. And so it's very problematic. And people have observed over time, people who have studied these things, that in summertime, when people are on vacations or on holiday time, people are at home rather than out around and at work if they're adults, or at school if they're children. And that situation of having people at home in close quarters results in an increase in violence against women. So we might have been able to predict that there would have been a real pandemic here, because in every country, people are staying at home and they're in close quarters, and they're much more likely to experience violence against women.